look into how kids and parents are dealing with ADHD and what other treatments are out there besides medication. KOMU8's Shale Remien has been gathering data for months. She's here to show us what the numbers look like for Missouri, as well as how a treatment option called neurofeedback works to exercise the brain.
Thanks, Jamie. I'm standing right outside of Dr. Jeff Tarrant's office, where I got a look to see how exactly this neurofeedback equipment works for patients with ADHD. Dr. Jeff Tarrant is an expert when it comes to neurofeedback, which is relatively new and measures brainwave activity. Although some patients, when they come to see Dr. Tarrant, are still on medication like Adderall, some use his therapy as a complete alternative. Jeff Johnson is a 15-year-old who loves to dance, skateboard, and goof off with his dad. But what you can't tell by looking at him is just like 1 in 5 high school-age boys, he also has ADHD.
I'm sitting there, thinking like, what can I do to help my child to overcome this diagnosis? I mean, because really, I look at it as there's no cure, because that's part of the brain. How did this happen? How can we fix this?
About 6.4 million children in the U.S. have been diagnosed since 2011. The number of children with ADHD will continue to rise. The CDC reports the percentage of kids diagnosed with ADHD went from 7.8 in 2003 to 11% by 2011.
Something as high as 10 or 12% of the, of children are, would meet criteria to be diagnosed with ADHD, which seems very, very high. And so that raises a lot of questions. Are we overdiagnosing? Are we misdiagnosing? What's going on?
Jeff was diagnosed at 9 years old and, like many kids, was put on medication.
Making him sleepy a lot, and he was just doing other things, and, I just couldn't do it anymore, So I just had to deal with him, and just try to work with him and show him the skills, and I think that's the biggest thing, is that we have to teach people skills, besides just sitting there saying, oh, let's just dope them up.
The amount of kids taking medication in a 3-year time span increased by 28%. Columbia Dr. Jeff Tarrant provides a unique alternative to medication that some parents are turning to, a therapy leveling out brainwaves called neurofeedback. Dr. Tarrant demonstrated the technology for us in his office. Dr. Tarrant connects sensors to a patient's head, sending signals to a computer based on the person's actions.
Feedback can be auditory signals. It could be different little games on the computer screen, so like a Pac-Man game. The brain has to do what I'm asking it to do in order for the Pac-Man to move, for to win the race, whatever it is that we're connecting to the data.
The patient can watch a movie, but only if the brain is doing what it's expected to do.
The screen is fully bright and the volume is all the way up. And as their brain starts shifting away from that, if it's not doing what I'm asking it to do, the screen dims, the volume drops. So the only way to be able to watch the movie, which is the reward, is to get the brain to do more of what I'm asking it to do.
Jeff's family won't consider alternative therapies like this one, and for now, he'll also remain off of medication.
There are people that have ADHD. I mean, they can just do a lot of things. I mean, stuff that I probably couldn't even do. Same way with those that have autism. They're smart. They can do a lot that most people can't do. I mean, I've seen that. I've been around people with mental illness, disability, and, they do great things, and they're smart.
I checked the numbers here right in Missouri and found the diagnoses and medication numbers are steady, with both slightly just declining. Reporting live in Columbia, Shale Remien, KOMU8 News.